So hi everybody. Again, thank you so much for joining us. My name is Rachel Long. I'm the regional coordinator for GFAN Asia Pacific. We're co-organizing this call with the Asia Pacific CRG platform. And I'll let Jennifer introduce herself right now.
Hi, good morning, good afternoon, everyone. My name is Jennifer Ho, and I'm the Deputy Director for APCASO, but also the manager for the Asia Pacific platform on communities, rights, and gender. Thanks, Rachel.
Thank you so much. So we've organized this webinar just so that we could introduce and also to explain and to share more information around the Global Fund's COVID-19 response mechanism and the 5% operational flexibility, specifically through the lens of community rights and gender. We've also have on our call some of the civil society and communities representatives that have been engaging in some responses at the country level. And who will share more of their experiences later. So without further ado, perhaps I'll move on to welcoming remarks from two of our other co-organizers. With us, we have Kate Thompson, the head of Community Rights and Gender Department, as well as R.D. Marte, the executive director for APCASO. So Kate?
Sorry, Rachel, before we continue, this is Jen. Can I just remind everyone that we'll be recording the session and we'll be discussing on the social media later on as well. So the recording is available later on. Thanks.
Thanks, Jen.
So, hi. Thank you, Rachel. Thank you, Jen. Good afternoon or good evening or good morning for Geneva-based colleagues. This is Kate Thompson from the CRG department at the Global Fund. I hope all of you and your loved ones are staying safe in these extraordinary and very challenging times. We're all having to adapt fast to the new realities that COVID's forced on all of us. And as usual, we're seeing communities leading the way in many aspects of the response, showing tremendous resilience and creativity and determination in the face of these massive challenges. And as I know all of you on the ground will see, we're having massive challenges to programs across the three diseases, challenges to access, challenges to prevention, challenges to treatment and support services, challenges to people's human rights, and challenges to livelihoods. We also know that without community leadership, the leadership of all of you and your communities who are on this call, we're not going to end COVID. And at the Global Fund, we are also trying to adapt and meet these challenges ourselves. So in this webinar, you'll hear about some of the things we're doing at the Global Fund. In particular, we'll share information and perspectives on the use of the new grant flexibilities and on the COVID-19 response mechanism, and trying to take all of this from the perspective of communities and civil society and really what's going to be most useful for you. So thanks very much to the organizers of this webinar, to GFAN and Asia Pacific and the CRG platform. And I hope you'll find the information and subsequent discussion useful in all of your efforts. And I very much look forward to listening in. So thanks very much, and back to you, Rachel.
Thank you so much. So RD, would you please go ahead?
Hi, everyone. Good afternoon from Bangkok. First off, just really quickly, a warm welcome on behalf of the APCASO APCRG team. It is indeed our extreme pleasure to be co-hosting this webinar with GFAN Asia Pacific. Also taking this opportunity, as Kate said, to wish everyone is keeping well and healthy, and also thank all of you who are joining, taking time from your busy schedule, preoccupations, responding to COVID as community movers and actors, as well as at the individual basis. Just to flag that this is part of a series of joint undertakings that we've had as APCASO APCRG with GFAN Asia Pacific. We've already had conducted a survey with community and civil society partners, trying to have more information about challenges that COVID has been imposing to communities and civil society at various levels in terms of issues of access, in terms of issues of engaging in Global Fund country dialogues, in terms of grant implementation, and also in terms of being able to catch up with what are the provisions related to COVID and flexibilities. And then we've had just a few weeks ago as well a focus group discussion also with Asia Pacific civil society partners to delve further into the issues. Hopefully we are moving more towards coming together with clarity on the tools at hand that we could use to serve the communities that we aim to serve and those that we represent, given the COVID context and the post-COVID context. Just to also acknowledge, thanks again, everyone. I see community and civil society partners, national, regional level, even from outside the region. I see a sister from Anglophone Africa. Olive, welcome. I also know, aside from Global Fund colleagues, we have people from UNAIDS Asia Pacific office also joining us. So just again, warm welcome and looking forward to the discussions. Thanks for joining. Back to you, Jen and Rachel.
Thanks, RD, and thanks, Kay. So I think let's move on with our agenda this afternoon. I think everybody is really eager to learn and to understand a little bit more about how communities are engaging and in response to COVID and how Global Fund is supporting some of these efforts right now. So our first speaker up, I'd like to introduce, it's Ms. Gongi Yakub. I'm not sure if I'm pronouncing your name correctly, but she is the Senior Fund Portfolio Manager for High Impact Asia Department. Gongi, are you online with us?
Yes, I'm here. Are you hear me?
Yes. Thank you so much for joining us, and apologies if I did not pronounce your name correctly. But can what Gongi will be speaking today is she will be introducing the two key mechanisms from the Global Fund in response to COVID-19. So let me turn the floor over to you. Gongi, is that okay?
Thank you so much. And you got my name perfectly right. So we're all good. Thank you very much for having me at your meeting. So as it was said, I will be giving a bit of an outline of the different financing mechanisms in response to the COVID-19 situation, which we all recognize that it has a potentially great impact on AIDS, TB, and malaria programs and health systems. And so in order to respond to this situation, we have put two financing mechanisms in place, the combined amount of which is $1 billion. And both of these mechanisms were basically designed to be lean, rapid responses, and they're quite interrelated. So this is what I will be speaking about throughout my presentation. Rachel, can you see my slides?
Rachel seemed to have left the meeting. Sorry, I think there's a bit of technical difficulty. Rachel, are you back?
Rachel muted. Her computer crashed, but she just restarted. Rachel muted.
Okay. Apologies, everyone. Just a little bit of technical difficulty. Let us give Rachel a couple minutes. Rachel, are you back?
Yes, I'm back. Just give me a couple of seconds. I am so sorry for this.
So while we wait for Rachel, may I suggest, I believe and I'm expecting that there will be a lot of questions as Gongi goes through her presentation. So we would like to request that if people can, please leave your questions in the chat box as we go through the presentation. And we have allocated about 10 minutes after each of the presenters have presented for Q&A, but we'll try to get to as many questions as we can this afternoon. Thank you. So Rachel, are we good to go? Yeah. Okay, perfect. Over to you again, Gangi.
Thank you very much. I'm still unable to change the slides though. Rachel, I will, may I tell you when to move on to the next slide?
I gave you the control, but let's do it from this end. Thank you.
All right, thanks. So next slide, please. So as I was mentioning, so the Global Fund has put in place two interrelated financing mechanisms to respond to the COVID-19 situation. One is what we term the grant flexibilities, and the other is the C-19 response mechanism. And the combined amount of these two financing mechanisms is $1 billion. Both of these are designed in a way to be fairly lean and rapid responses, and I will explain how, as well as the interrelation between these two. Next slide, please. So the grant flexibilities is the mechanism that allows countries to reprogram their savings and their grant activities under their existing grants. So principal recipients may reprogram 5% of their savings and or 5% of their grant activities up to a total of 10% of the grant value as measured against the total amount allocated to them in the current 2017-2019 funding cycle. In addition to that, they also have the flexibility to redeploy the resources that are procured through the existing grants, particularly if there's infrastructure that has been procured under the grant or capacities that the grants are paying for, which are underutilized at the moment as a result of the COVID-19 situation. The total amount across the portfolio available for reprogramming is $500 million. And this is eligible to all countries that have current Global Fund grants in place. Next slide, please. Within this mechanism, next slide. Within this mechanism, there are six main priorities. And I would like to emphasize that this is a non-exhaustive list. As the situation evolves, as we are receiving different requests, as the reality is becoming more apparent, of course, we need to also respond to those realities on the ground. But essentially, these six categories were identified as the main priorities for financing. So first of all, the epidemic preparedness assessment, and generally helping the countries to prepare for the epidemic preparedness, which can mean risk and cost-benefit analysis, or setting up rapid response teams, providing trainings and equipment to these rapid response teams, etc. The second category is around laboratory testing, and primarily referring to equipment for laboratory testing, but any other preparedness that laboratories require in order to be able to effectively diagnose COVID-related issues. The third is around sample transportation, transportation to lab, or any other investment for developing an integrated sample transportation mechanism. Use of surveillance infrastructure, which includes also contract tracing and effective surveillance mechanism. Infection control in health facilities, including personal protective equipment, and information campaigns for health staff and for the general populations. All activities under for Global Fund financing must meet WHO recommendations and guidelines, including any of the equipment that is being procured. Next slide, please. So as I mentioned, we designed this mechanism to be very rapid in terms of providing a response. So the overall timeline that's been defined for responding to a country's request is 5 days. And basically, we expect the submission from the PRs at any time during the grant. It is reviewed at the secretariat level, and within a 5-day period, the requests are generally turned around. And the funds that are identified under this mechanism, they must be utilized until the end of the grant, whether that's whatever the time frame remaining from this current funding cycle. There are a few, next slide, please. There are a few stipulations regarding this financing mechanism. Firstly, PRs are, it's the PRs that submit the request to the Global Fund for financing, and they're encouraged to seek CCM endorsement, but at a minimum, the CCM must be informed about the requests. All expenditures must be prior approved by the Global Fund, and as I mentioned, all activities must follow WHO guidelines. When submitting the request, we ask countries for some information regarding what the funding is requested for, and to provide us with a quite simple format of the budget. And one of the other elements that we request information on is to consider the negative effects on grant implementation and to suggest mitigating actions. So the request must outline how by reprogramming some of the funds, the implementation of the AIDS, TB, and malaria programs would be impacted, and what are the measures to mitigate any of that impact. And finally, we of course require reporting on the expenditure related to COVID-19, and those expenditures are reported with the progress updates that we receive from the PRs through their regular reporting. Now, I wanted to give you an idea of how how the funds have been utilized across the portfolio. So up till the end of yesterday, so far out of the 500 million that's available, 129 million has been approved for 81 countries and 6 multi-country grants across the portfolio. Within the Asia Pacific region, 41.3 million has been approved for 19 countries and multi-country grants. So these are, you can see the list of the countries there, with Philippines, Indonesia, Myanmar, and Pakistan being the countries that have requested the most. And these 19 countries were really the ones that have seized the opportunity to react quickly to the COVID-19 situation within the limits of their savings. At this moment, none of the countries have reached the upper ceiling amount that is available to them under this mechanism. So there's still space for reallocating additional funds through this mechanism. It's difficult to anticipate for across the entire portfolio what will be still coming, but each country team is in contact with their counterparts, and there are additional requests in the pipeline being prepared. Next slide, please. So this was one of the mechanisms now on the C19 response mechanism. So again, the total allocation for the C19 RM is $500 million, and countries with current Global Fund grants are eligible for applying for this funding. The different areas for which funding can be used for are mitigating the impact of the COVID-19 situation on the HIV, TB, and malaria programs, reinforcing the country's response to COVID-19, and investing into urgent improvements in health and community systems, which may include a range of issues, including laboratory networks, supply chains, and engagement with vulnerable communities, as well as others. Next slide, please. So the funding priorities within the C19 RM mechanism. So it's important to explain that countries are eligible to receive an incremental amount under the C19 mechanism that is equivalent to up to 10% of their respective 2020-2022 allocation. So it's the next allocation that's already been announced under the 6th replenishment period. Out of that, countries can apply for a maximum of 10%. That's an additional financing that becomes available. However, if they have already applied for any funding under the grant flexibilities, that is the additional amount that they can receive under C19 RM is reduced by that equivalent amount. The C19 RM mechanism has been split into two windows. One is called the Priority 1 window, and these are the primary funding requests, under which countries can apply for a 3.25% of the 10% total amount. And this is the window that has already been funded. And so if the proposal that is submitted by countries is technically sound, funds are immediately available for eligible countries. So again, this is up 3.25% of their total 2020-2022 allocation. The Priority 2 window is defined as an additional funding request, and this will be funded if additional funding becomes available to the Global Fund. So we request countries to, as much as possible, express their full need within the 10% within the same application. The 3.25% is funded if technically sound, and the remaining piece, the 6.75%, will be funded if additional funding becomes available to the Global Fund. Next slide, please. Again, the timeline aims to be fairly responsive and fairly quick. So the commitment that we have made is to respond to the priority 1 funding requests within a 10-day period. CCMs have been asked to submit their applications by 31st of May of this year, so in the next 2 weeks. It is reviewed by the Secretariat, and in this case, the funds may be utilized for a 1-year period, so until the 30th of June, 2021. Next slide, please. The stipulations regarding the C19RM mechanism are that these applications are submitted to the Global Fund by the CCM. And before applying for C19RM support, countries are requested and encouraged to analyze their current grant savings and reprogramming opportunities first, and then to submit their applications for the additional funding. Again, all activities must follow the WHO's guidance. And as I mentioned, we request countries to, as much as possible, to make their requests for priority 1 and 2 at the same time. However, if this is not possible, we will, of course, look at separate applications as well. Next slide, please. So just to make sure that it's clear, I wanted to just recap on the key differences between the two mechanisms. So with the grant flexibilities do not provide incremental funding to what is available to the countries, whereas under the C19RM mechanism, this is incremental funding that is available. Grant flexibilities allow a total of 10% against the current 2017-2019 allocation, whereas the C19RM fund is a total of 10% against the next cycle, to the 2020-2022 allocation, minus the funds accessed through the flexibilities. So this is how these two mechanisms are interrelated with one another. The requests for grant flexibilities are submitted by the principal recipients, whereas the C19RM mechanism is submitted by the CCMs. Next slide, please. So I hope that helps to clarify. I am very happy to answer any one of your questions in case you need some further information. But in closing, I would just like to say that given that the situation is so new and so rapidly evolving, we're of course all learning still about what is happening on the ground. And in my opinion, it's really important to get your feedback from the communities on what you think are really important for us to consider in our responses, and for us to be able to feed that back into our own policy development. So I'm really grateful to have the opportunity to participate in this session, and I look forward to hearing from you, both your questions and your feedback. Thank you.
Thank you so much, Gangi. That was really concise and really clear. I'm looking on the chat box for questions, and also I do not see any right now, but are there any immediate questions anybody on the online right now would like to ask? And if so, can you please signal your raise hand sign so that we can get to you? Okay, well, I see a question right now. Would you, Nayan, would you like to ask your question directly? If you could unmute yourself.
Hello, do you hear me?
Yep, go ahead.
Thank you very much for your very detailed explanation. I just want to know only one thing. How about the time frame to use just 5% flexibility? Which period is covered?
Would you like me to answer to all questions one by one? Okay. So the time frame for using the flexibilities is the duration of the current grant. If your grant ends at the end of December of this year, then the funds can be used until then. If the grant ends next year, then the funds can be used until then.
Okay, thank you so much.
Hi. Hello.
Hi, Viang. Thank you. I think Jennifer's trying to unmute herself. She's informed that her internet is a little bit unstable today in her home. So we have a couple of chat questions. So we're going to take a couple of questions first, and then maybe Yonggi, thank you so much for your presentation. It's very clear. There's also an email address that was provided before that we will be able to share with you if you have additional questions. So there are a couple of questions in the chat. You've actually touched a little bit more about the time frame in your slides. There was also a question from Niluka about whether the two mechanisms are mutually exclusive. Then Gemma has a question around in preparing the applications, are PRs required to consult communities on the priorities for funding? Is there any requirement for meaningful engagement of communities as there is for regular global funding requests? I think I also have one question as well that's related to what Gemma had asked, because in the flexibilities presentation part, you did say that the CCM has to be informed, but not that the PRs can go direct to the Global Fund Secretariat. Maybe elaborate a little bit more about that. Viang, would you like to ask your question as you have your hand up as well? And then Yonggi, please go ahead to respond.
Yes, I'm Viang from Laos. I have one question related to the funding priority, but in terms of the Global Fund policy, is this the funding based on the national action plan of the COVID response? My question related to that community is not in the national action plan of the COVID response, but this is the how we can fund of the community. This is my question.
Thanks so much, Viang. So perhaps I think Jen is back, but Yonggi, please go ahead to respond to the questions.
Sure, thank you so much. Those are really great questions. So with regard to the question about whether the two mechanisms are mutually exclusive, I think the correct way of putting it would be that they're mutually reinforcing. So countries can apply to both of the mechanisms. However, the amount available under the C19RM mechanism is reduced by the amount that has already been accessed through the grant flexibilities. So let me give you an example. If the country has 100 million allocation in the 2020-2022 funding cycle, the upper ceiling amount available under the C19RM mechanism would be 10 million. If the country has already accessed savings and reprogrammings to the value of $5 million from their current grants for the COVID-19 response, then the remaining amount under the C19RM mechanism would be 5 million. Out of this, 3.5 million would be through the priority 1 window and the remaining under the priority 2 window. So they're not exclusive, they're reinforcing, and we make sure that there is a clear understanding that if a C19RM application is submitted, what has already been accessed through the flexibilities, and that there's no duplication between these two. The question regarding community involvement and to elaborate on the CCM's involvement. So again, the flexibilities, grant flexibilities, the aim here was really to make sure that we have a very rapid response to the emerging needs that are coming in the countries. And so here the mechanism was designed in a way that the principal recipients identify the savings and the opportunities for reprogramming within their grants and submit those directly to the Global Fund. We encourage countries to seek CCM endorsement. However, this is not always feasible if speed is of the essence. And so at a minimum, PRs are requested to keep the CCM informed by copying them on the email submission, and CCMs to have a full understanding of what are the different funds that are being requested from the different PRs. Under the C19RM mechanism, it is the CCM that submits the funding request, so we expect a CCM endorsement and a consultation within the CCM. And I think the Global Fund country teams play a role in ensuring that we advocate for the involvement of the communities in that dialogue to the extent that is practicable. So I would expect that any request that is submitted there is informed by communities' inputs. Finally, the question regarding living support. So this is an issue that is coming up more, and so there was a question whether living support can be provided under the flexibilities or the C19RM mechanism, and I'm assuming this also involves the nutritional support. So let me address that question. So this is an issue that is coming up more and more often across the portfolio, and something that we're looking at and concerned about ourselves. This is not generally an activity that the Global Fund is set up to do. We don't have wide-ranging experience with providing living support, with the exception of some nutritional support for patients in the TB programs and the HIV programs who are receiving treatment. So where that mechanism exists, it is somewhat easier to consider providing this kind of support. That said, where possible, we tend to encourage applicants to look at other possible mechanisms that are available. So first and foremost, if there is a government food program, to seek support through that mechanism. That said, we understand that there are some challenges with this. We understand that quite often key populations are missing the required IDs in order to be able to access living support through the government mechanism. So if that is not feasible, then also another option would be to look to the World Food Programme and to see if it's possible to work there together. If not possible, then we would encourage countries to discuss this with their country teams to submit a proposal to addressing the challenges, and then it's evaluated on a case-by-case basis. What is critical is to really ensure that the operational mechanism around any kind of support like this is worked out clearly and explained in any sort of request for funding. I hope that answers the questions that have come up so far. If not, I'm happy to continue.
Sure, thanks so much, Gyeonggi. Jen, are you back? Would you?
Yes, I am back. Thank you so much, Rachel, for taking over. But thanks also, Gyeonggi, for that really, really comprehensive and detailed explanation. I know that we still have a lot of questions that we're not going to be able to get to due to time limitation, but we'll keep these questions available, and we will, as the platform and also GFAN Asia Pacific, we will be having follow-up communications, and hopefully some of these informations will be further clarified as well for some of the questions. I would also like to take this opportunity to also encourage civil society and community partners to reach out to your FPMs as well if you have any further questions. But thanks again, Gyeonggi, for the presentation. Much appreciated. So let's move on to the next set of speaker, and I'll turn the floor over back to Rachel.
Thanks so much, Jen, and thanks again, Gyeonggi. I think there are also some questions that have also started that haven't been responded to. So while we're continuing with the webinar, please feel free, Gyeonggi, to respond to some of the questions on the chat box as well. So the next slate of presenters, we have quite a few. Apologies if I've just grabbed some of these pictures of your Facebook profile. So we're going to start off with a couple of perspectives from the ground. We have the honor to have colleagues from various countries, from Indonesia, from Pakistan, from Myanmar, from Thailand, to share their perspectives from different points of view and their different positions as different stakeholders. So without further ado, I'll turn this over to Daniel.
Yes, thank you, Rachel. Thank you, Jen. I'm Daniel Marguari from Spiritia Foundation. My organization is one of the communities PR in Indonesia working for TB HIV. Can you start with the slide, please?
Hi, Daniel. Did you send a slide in the last half an hour? If you did, I might not have received it.
I sent last night.
Oh, okay. Just hang on a moment, everyone, and enjoy Daniel's beautiful face while I upload that slide.
Daniel, you're always beautiful.
Thanks, Biang. How are you?
Gangi, are you still online with us? Because I mean, perhaps we can take this time to answer some of the questions in the chat box. And I don't actually have all the questions because my system crashed earlier, but I do see there's a question about how do regional and multi-country grants apply for grants flexibilities, and will that require informing CCM of all the countries? It's
Yeah, I'm still here. So multi-country grants can also apply, and they can use grant funds in the constituent countries, even including countries which are ineligible for global fund allocation, up to a total value of 5% of the grant. So this is the multi-country grants apply the same through the same mechanism as the national grants.
okay, great. Thank you. And I see that Rachel, you got, thank you so much again, Gangi. Rachel, you got Daniel's slides back on?
I just forward to you, Jane, and to Rachel again in the last second. Maybe you can get it.
And my sincere
Hi all,
apologies.
so give me a second. I'm trying to not let the computer crash by switching screens. So apologies for this.
Perhaps I can add in the meanwhile that there are some quite comprehensive Q&A documents online available on the Global Funds COVID page, and they respond well to a lot of the questions that we have received internally and externally so far on the two financing mechanisms. So I would encourage you to consult those.
Great, thank you. And I think as APCRG, and I think also through the GFAN AP listserv that we have shared those that particular info sheet as well, but we will make sure that gets circulated again after the webinar. Thanks, Gangi.
So how time for me to continue?
Yes, please.
Okay.
Yeah.
Okay. Thank you. Could you move the slide, please? Thank you, Rachel. Yeah, as I told you, my organization is one of the CSOPR in Indonesia. We are managing a program for TB HIV, but mainly program for HIV. Our organization managing a program for two cycle of the Global Fund funding with 2016 and 2017, we managed for 23 millions, then continue with 32 millions with the same focus of intervention for prevention and psychosocial for PLHIVs, for MSMTGP with yes, and for PLHIVs, and some of other related with the community programs. Relate on that, we managing a program with partnering in the first cycle is more than 100 organizations. Then we did a cost effectiveness with become 80 partners for SR, SSRs, implementing unit and others in all the provinces in the countries, 34 of 34 and 240 districts of 500 districts in Indonesia. We have partner supporting more than 2,000 workers through this funding and mechanism. Slide, please. Yes, relate with the COVID implication. To be honest, it's getting stressed in the beginning because, it's we cannot implement almost all the activities, especially meeting, training, and all people who meet more than 10 people or 20 people or even and some activities to reaching the key population for change the behavior, refer for the testing and support PLHIV. Almost the activities is it cannot implement anymore. Then we develop the simple assessment. We conduct to all the partners to get what's going on in the field. And then based on that, we decide that we need to continue our work with the virtual mechanism. So we mapping the by geographical which places that we can continue by face-to-face activities, and the rest of what we need to continue by virtual because it's not eligible anymore to continue with the face-to-face. With the new policy what we develop, also the technical guidance. So with the face-to-face activities, who continue the activities of reaching the key population and then refer them with the services. And some of the services it's closed or they're not, they just put the priority for COVID patient or COVID focus, and then it's very difficult for people get the testing. And then we create cases, local how to solve the local cases thing with some protocol. And we provide the mask for them, hand sanitizer, infrared thermometer for some of the activities, and all those things we communicate with the country team. I personally have a strong communication with them. Informally, formally, we create communication continuously to get support from them, what the policy or mechanism or activities what we provide, get the support and approval from them. And then especially with the virtual activities, we develop many a new technical guidance of how to implement the virtual mechanism. We still reaching people for key population with social media, with virtual support PLHIV to accessing on treatment, to continue the treatment, to bring the treatment at home, the drug, and so many kind of activities. We conduct a training. We divided training just for 8 people in the separate places, or maybe we create so many kind of by time, by people, by location, and by module, and we create all virtually. And we need to report this. We develop the recording mechanism, reporting mechanism by virtual, and we support all the partner with a Zoom paid, a monthly paid, and internet package. So because all participants attend, join the meeting, need to get the support with the internet package. So we support them with a kind of the meeting with that one. That all the activities we conduct, we do not propose the reprogramming related with COVID 5%, the flexibilities, or 10% flexibilities, the new policy one. All those things we using the existing money. We find the saving and we use the same saving, and we propose and get approval. That's what we have been doing. By yesterday, we get the result. There are improvement in terms of the activities implement. People reach. People get the support. It's increased in the last few weeks after we implement the virtual mechanism. In the last slide, I let you know that we also already proposed to the Global Fund to use the flexibility of the money for living support for key population and PLHIVs. We proposed already 1.6 million and still waiting for the approval from the country team. And we plan then to continue to propose the second of 1.6 because my organization managed 32 million, so it's eligible for 3.2 million to propose. So we wait the approval and then we will come with the next step. So all this support will go through living support for around 25,000 communities will get this living support, and we create this connecting with the kind HIV activities. What it means, for key population who get the testing of VCT, then they will get the living support. For PLHIV already on treatment, then they will get the living support. So all support it will connecting with the activities, the target, what we plan, and to achieve those what we plan. That's the some of the activities we have been doing a few weeks. Last week we already have a commitment with the MOH. MOH agreed to implement the community-based screening. It's because of COVID, so COVID give the positive implication also. Make Minister of Health will provide the policy to implement community-based screening very soon, because our testing result is very low now, and other policy and support from other partners is on the table right now. Thank you.
Thanks so much, Daniel. So we'll take questions from everybody on the chat box to Daniel right now. But because of the interest of time, we're going to move on to the next speaker to share their experiences. So we have Ashka. Ashka, would you please share your experiences from us as well? And I'll also move on to your slide. Ashka is an SR under the government's grant from the Ministry of Health in Pakistan, and is the national coordinator for the Association of People Living with HIV.
Hello, everybody, and good noon from Pakistan. And thank you very much, Rachel, RD, and Jennifer, for providing me with the opportunity. I would be very crisp as per the points which have been shared that I have talked about. The impact of COVID-19 in Pakistan is not much different than from the other countries. Basically, the lockdown situation and the social distancing things, they have affected the communities and the provision of services in a very severe way, I would say. And probably just to control the things, the HIV prevention and testing services, they are almost at a halt. But in the APL-HIV, that is the Association of People Living with HIV, being one of the sub-recipient of the Global Fund grant in HIV component, basically, our primary task is to provide community-based monitoring over the services being provided by the public sector. So the first case of COVID-19 in Pakistan was reported somewhere on 26th of February. And right from that particular time, we started off, thinking a bit ahead that how this could impact people living with HIV and associated key population. So we had a kind of discussion with the UNAIDS country director, and she was also a bit worried about the rising situation. And then we saw suddenly an kind of increase in number of COVID infections. So finally, the different provinces, with different methodologies, they led towards, lockdown situation. In some areas, it was, kind of a strict lockdown. In some areas, it was kind of partial lockdown. In some areas, it was kind of a smart lockdown. But overall, the impact was that, the public transport was totally closed. The railway operations, they were totally closed. The air operation, that was totally closed. So definitely that had to impact the access of people living with HIV to essential and life-saving, drugs. So it was somewhere in mid of March that the APL-HIV team sat together, and we decided that we have to, ensure that we respond to the needs of the communities. And we came up with the idea that we should establish a kind of emergency response cell at the Federal Secretariat of the APL-HIV. And we did that, which initially worked around the clock. And basically the emergency response cell basically focused on three particular things. Number one is that we have to facilitate people living with HIV to have access to life-saving drugs, that is the ARVs, or to provide them the ARVs, at the doorstep. Second was, to provide them with the prevention information. And third was to, simultaneously advocate with the government for the facilitation of, the services to the people living with HIV. So we were quite successful. Initially, might be the idea of establishing an emergency response cell was questioned by some of the corners, but with the passage of the time, the idea was not only accepted, but it was, welcomed. And we had really, and having still, very good coordination and cooperation with all the stakeholders, including the UN partners, the Global Fund, the PR, the government sector, and above all, the Ministry of National Health Services as well. So we started off with the operation, and just as you can see on the slide, that we have been able not only to facilitate the people in accessing the life-saving drugs, but around 200 people we have been able to provide them with the ARVs at their doorsteps, who were totally unable to access the treatment centers, and those were in far-flung areas of the country. And the operation is still on, and I am going to the warehouse of the ministry to get another shipment just after this meeting. Then we also ensured that whatever the availability, depending upon the availability of the funds, we continue with timely provision of nutritional support to the people living with HIV. And we did that in the month of March as well, before the lockdown could basically take place. And it was a very timely, kind of a support that the community got well in time. And in last week, again, we have provided to over 3,300 people with the nutritional support. And during this, 45 days of operation, we have provided approximately over 6,000 people living with HIV with the nutritional support, and that comes under the Global Fund grant. In addition, the emergency response cell on daily basis keeps sending in local languages the shorts, messages about, keeping them safe and from the COVID. And so far, over 100,000 messages they have been sent to the people living with HIV and the key populations. And we have also made use of social media as well, so that the people who have access to the social media, they also get that information. And over 13,000 people have accessed our information on the social media as well. And similarly, so far in 45 days of time, we have received almost 3,200, telephonic calls, and who were provided with the counseling, with the information that how the community people, they have to prevent themselves from the COVID-19. So these are the couple of things that we did. And another important thing is that our rapid kind of the survey to identify that what are the needs of people living with HIV in face of COVID-19, that is underway with the support of UNAIDS country office, and a sample size of approximately 550 people that is being touched, and the process is in the implementation, and we are expecting to complete this survey somewhere by mid of next week. In addition, a detailed research study that we are in negotiation with University of Manitoba, and we are expecting that a national level research study on the impact of COVID-19 on HIV and associated key population, that is also going to start very soon. I am hopeful for that as well. So this is just a brief kind of a thing. And with regard to the challenges that we are facing is definitely being a third world country, Pakistan definitely has the limitation of resources and the availability of nutritional support that is very limited because of the financial constraint that we have under the Global Fund grant. So we are looking for some other means as well. And the government of Pakistan has launched, a social protection program where 12,000 Pakistani rupees they are being given as one-time support to the needy people. And we have also linked up about 4,200 people from the HIV community with that government program. So now we are following up that how many people they have got the support and how many they are still, in the waiting line. So that is the update from my side. Thank you.
Thank you so much, Ashra. This is really, really amazing work for some of the country responses given the span of 2 months. I really liked your comment about how a third world country like Pakistan is responding to this epidemic, but we're also seeing how this has crippled a lot of the major donor countries. So this is something that we'll all have to deal with together. So in the interest of time, I'm going to move on to perspectives from TB and introduce Dr. Nien Bin Pyo. I hope I got the pronunciation correct, who is the Health Monitoring and Evaluation Coordinator and Technical Service Division, Health Department at the World Vision Foundation of Thailand.
Okay. Thank you very much for APCRG and GFN for coordinating this experience sharing work meeting. Thank you very much everyone for giving me this opportunity to present ground experience of Thailand. So let me introduce myself. I'm from World Vision, Thailand. World Vision is one of the largest civil society working for TB, HIV, and malaria among migrants population in Thailand. So in Thailand, there are 2 PRs, one PR CSO and one PR government. Both PR received around about $14 million for 2018 to 2023 years period. So with 5% flexibility is more than $700,000 received from Global Fund to respond to COVID-19. So far we used $85,000 we used already. So before going further, we need to look at first what was really happening in TB and HIV services during the COVID crisis in Thailand. So luckily in Thailand, there is no service discontinuation during the pandemic, and both TB and HIV get equal attention with the COVID-19. So to run all services smoothly, Ministry of Public Health introduced door-to-door service by using Grab, drug, motorcycle messengers, by using the existing health volunteers network. For those who do not need to see physicians and don't need to do the lab test, or if you can see in the picture in the slide. So we call it.
Hi, Dr. Nien, I'm sorry, yes. I've got a request, but could you please speak closer to the microphone? The people are saying that it's a little bit faint. Thank you so much. Sorry for the interruption.
It's okay, no problem. Okay, so to continue all services smoothly, Ministry of Public Health introduced door-to-door service by using the Grab, drug, motorcycle messengers, by using the existing health volunteers. For those who do not need to see physicians and no need to do the additional lab tests. So you can see picture in the PowerPoint. So we call the drug delivery messengers. Thai government also set 1 month policy aimed to fight both TB and COVID-19. So we distributed not only masks, but also share TB and COVID-19 health education too. Because if you look at the Ministry of Public Health Facebook or website, they always announce together for TB and COVID-19 because both are airborne or dropless infections. So in reality, it's likely TB and HIV services are faster than before during this crisis because very less patients crowded in TB and HIV clinic days. But with assistance of the civil society organization as a liaison office, we can also maintain the cross-border drug supply for migrants who are back to their home country and not able to come back in time due to the country lockdown. So next slide, please. Impact of 5% flexibility under the World Vision Thailand. So marginalized populations like migrants from Myanmar, Cambodia, Laos, and Vietnam are getting this fund as a target beneficiaries because of in Thailand, around about 3.9 million of migrants are working and 100,000 return to home country during the pandemic period. So 2.7 million time baht directly goes to that migrant with fund of surgical masks, hand gel, alcohol, and touch thermometer, disinfection liquids, and alcohol bags. We distributed all these protective items to the migrant people. So as a direct beneficiaries, around about 39,000 migrants people get direct benefit from 5% budget. So not only that, we have another two funding source from WHO, UNICEF, and other individual donors. We use this budget as together, and we produce INC protection, patient care support. We developed digital education platform, established COVID-19 hotline services for migrants who have language barriers, and using COVID-19 etiquette findings and mental to reach migrants population. So usually we develop the 4 languages: English, Myanmar, Cambodia, and Lao. So we have 3 hotline services for English, Myanmar, and Cambodia. So next slide, please. So regarding on the Gene Expert Express future, I don't think Thai government will procure this machine unless special needs, because they already have enough resources for COVID testing as a nationwide, and they have 20,000 test capability per day if they need. Next slide, please. Okay. So can you go back to the last slide? Okay, if you look at the figure for China, and then everything will get back to new normal life in next month, because government released some restrictions and movement already starting from May, and seems like virus containment and mitigation strategy works. So as for the implementers, there is no huge impact of global fund works, except some community trainings and meetings because of some curfews and some announcements from the Ministry of Public Health. But for the case detection, follow-up, and implementation, we switch from conservative ways to digital ways and use messenger services as much as we can. So these are from the Thailand experiences, and thank you so much for your attention.
Thank you so much, Dr. Nian, for sharing experiences. I know that we also have a couple of TB activists on the chat. So please do have any comments around the situation with TB responses during the COVID-19 pandemic. In the chat box, we know that there are a lot of challenges in many different countries. Right. And as Dr. Nian had pointed out in this last slide, this is a new normal that we're all going to have to live with. Even expressed by WHO earlier on yesterday or today, that it's going to be something very similar to HIV. And we might not even see waves in the future. So without further ado, again, I'm going to share the next the stage with Dr. Yong. I hope I'm pronouncing your name correctly. He's the program manager for Malaria Save the Children in Myanmar. Dr. Ong?
Yes, I am here.
Thank you.
Okay. Good afternoon, everyone. I am therefore giving me an opportunity for my presentation. Let me introduce myself. I work for the Save the Children on the Right to Win Malaria project as a program manager in Myanmar. The information in my presentation is based on my project and also reference from the presentation of National Malaria Control Program Myanmar in Technical Strategic Group meeting. In my presentation, there is a lot of information, and I would like to highlight the key point in my meeting minutes. Next slide. Yes. The first slide I would like to present is the impact of COVID-19 on malaria implementation in Myanmar. For the first one, in our country, it is gradually decreasing in testing rate due to the mentioned point, fever clinic activity in health facility, and the reluctance of testing fever patient by the volunteer, and also no outreach activity. And during COVID-19 current situation in our country, there was some restriction in travel and night stay in most of the area. Consequently, most of the activity are difficult to conduct in our coverage. It means that the reduce the getting percentage and the reduce the frequency of monitoring, and also the difficult to replenishment for the store level to the volunteer. Thanks. Next slide. And also that mass group gathering also totally restricted in our country. It means that it was not allowed by the government administrative department to conduct the large group meeting, large group gathering, something like that. the training, also meeting, also the mass education session. Another thing is that we have no insufficient personal protective equipment to proceed the operation when the starting of the COVID-19 in our country. And also for the quarantine measure, there will be step delay to the duty station. Next slide. As you all know that our country, Myanmar, is the first country to request the funding for the malaria implementation with the COVID-19 context. So I will represent in this slide why we need for the reprogramming. We need to think about the additional supply, not to be stock shortage and also stock out in our field level. So as the procurement process may be too long in COVID-19 current situation, we need to think about the additional stock supply. And also for safety at the operational level, it is also needed to provide mask, hand gel, or glove face shield to the malaria worker and also the outreach staff. And also we need to think about to distribute the guideline and also malaria awareness IEC material to the malaria worker. Besides, there will be high operation costs for the activity such as report collection and also supervision and also high internet virtual meeting. The last thing we think about is the incentive for the ICMV as a hazard allowance for the motivation. It can lead to continuous case detection and also the increasing our testing rate. Thanks. Next slide. The next slide is that if we start the malaria activity with the COVID-19, we may face the challenges as mentioned in this slide. The most important thing is that we need to get approval from the respective health authority, especially from the government administration department. If we didn't get the approval from this local authority, we will not conduct, we can't conduct our malaria activity. And then if the restriction was lifted, and we need to consider about the social distancing, also the protective measure to conduct the training or the meeting. Another thing is that although the COVID-19 situation is a little bit stable in our country, there may be limitation of collecting report and supervision to volunteer for the harder duty area because there will be some limitation at the community level, although it was allowed to travel by the local authority. This is happening in our ground level. The same condition of the malaria elimination surveillance activity, like the collecting report and also supervision. And also there may be also the limitation or direct support to the beneficiary, something like the bad net distribution. The main thing we need to consider is for the reprogramming is that to provide continuous supply to the personal protective material to the frontline staff and also the volunteer. It is very important. It can leave them more confident in coordinating their activity, and also that there may be difficult to achieve our indicated target during the COVID-19 situation because of previous mentioned slide. And also due to the mobile network limitation, there may be a difficult to contact all volunteer and also higher in draw out volunteer rate in this situation. Thanks. Next slide. The last slide is the way forward or the malaria activity with the COVID-19. We will continue our case detection with the guidance of the COVID-19 precaution, and also we will use the mobile phone and also social chat application to get report and monitoring to the volunteer. If the volunteer are from the hardest duty area with the poor mobile network, it will reach by our frontline staff. And also for the replenishment of the stock, we will share the information of focal person to contact by the volunteer for the respective field office. And also for the draw out rate, we will conduct the on-job training to the new volunteer, something like that. And also the current situation is that there in our country, the public transport is totally closed, and also the restriction is not lifted till now. For the guideline and also the IC awareness, National Malaria Control Program is developing about it. Thanks. That's all. Thanks for giving me time for my presentation.
Thanks so much, Dr. Ong. I will then move on to the final speaker from civil society. May, I hope you don't mind. I grabbed this picture of Facebook for you. So May Rind is the chair of the Positive Indonesian Network, as well as a member of the CCM in Indonesia. So she'll share a little bit from her perspectives as how things had to work virtually as a CCM member during this time, as a positive representative on the CCM. Due to the interest of time, I'm giving everybody fair warning. We're not going to have an opportunity for people to ask questions and for people to respond after May's presentation. So I'm encouraging everybody to engage in the group chat as May is presenting and as the presentations go on. So May, over to you, please.
Thank you so much, Rachel, and thank you for having me in this webinar. I really appreciate. So I will bring my perspective from a CCM member. How about the CCM Indonesia response, especially to the COVID-19? So the CCM Indonesia has responded quickly to a letter from the Global Fund that has been sent to the Minister of Health regarding the offer to use the funds that currently available for COVID-19 response. And then the Global Fund has approved our proposal for a COVID-19 response of 8.6 million, and which was taken from the total saving of the 3 principal recipients from the Ministry of Health, which consists of AIDS, TB, and malaria. And the proposal agreed to purchase personal protection equipment, specimen tests, masks, box specimen transportations, and also for the epidemiology investigation of COVID-19 cartridges. And then through the technical working group, 2 task force formed to respond to the COVID-19, both for HIV and TB. This task force has strong involvement from the community and also from the CSOs. And this task force is not limited to members of the technical working group or the CCM members. And currently, the task force is, they are developing a COVID impact mitigation proposal to be submitted to the Global Fund. So, and also data on the impact of COVID-19 to support the proposal actually has been gathered from many organizations, including from the community-based organizations. Currently, we have data regarding the impact of COVID-19 on people living with HIV, on transgender people, young key populations, women living with HIV, and also on TB, MDR patients, and also female sex worker. Besides, we also obtained preliminary data on the impact of COVID-19 on domestic violence from one of the victims of violence service organizations. This is very important because we understand that some of the key population is really prone to the violence, especially for the women, because we heard that the domestic violence is increasing right now, and these data are used as a basis for submitting the proposal. And also, some organizations has committed will conduct regular survey in this regard. But since we also know that the Global Fund allowed the PRs to submit directly to them regarding the programming implementation related to the COVID-19, I raised about this issue during the CCM Oversight Committee meetings because we heard that some of the PRs just decided by their organizations what they want to reprogramming for the in the response of COVID-19, and then we decided that in the future that there will be a joint coordination between the task force, and also we will invite the PRs to discuss about this issue, because we really need to get update from the PRs and ensure that what they already reprogram is based on the needs of the programs and also for the sake of beneficiaries. And from my perspective, I see that now CCM Indonesia response can now be considered quite good. We have better communication, especially during these working from home. We have routine coordinations because I don't know, I think it's now more easily to get people come to the virtual meeting rather than to face-to-face meeting. And I also grateful that issue related to the implementation of the current grant get more attentions in the CCM and also the technical working group. And then we a lot of things that we discussed and then decided at the CCM. But also looking at the dynamics that occur in the community and also the changes in the program implementations, the political situations, the disease situations, I think it seems to be considered to make changes in the CCM functions. I heard about the evolution of CCM and the evolution of CCM as a vehicle for national coordination for health. I think this is also a good option, and we can start to discuss about this because in Indonesia, almost all issues related to this to the 3 diseases, HIV, TB, and malaria are discussed. Even now, including COVID-19, and we and somehow sometimes we discuss about other projects not funded by Global Fund, and we use the CCM mechanism and technical working group mechanism to get input feedbacks about that project. And also at this time, specifically for HIV and maybe also for TB, we don't have a national coordinating forum right now, although for specifically for HIV, although the president already gave a mandate to the coordinating Ministry for Human Development and Cultural Affairs to carry out the coordination function on the issue of HIV, but this was not done. So we're considering improving CCM functions and roles might already be thought of, at least for Indonesia. And just last week on the Oversight Committee, we start to discuss about to conduct review and revise related to the CCM work plan and governance manual. Because everything has changed. The virtual meetings, the situation has changed, and it is considered irrelevant to the current situation. And moreover, with the existence of COVID-19, some policies cannot be applied, so it is necessary to review, especially for the CCM governance manual. And also, the review and revision are very important to be done immediately. From my perspective as the communities, it's to ensure that the community and especially for the affected people with the disease have a significant and meaningful role in the CCM, so that they can understand about the situations and can make the right decisions. During this almost 1 year being a member of the CCM, I see the need still, the needs to increase the capacity of the community, especially the affected people who sit at the CCM. So, so that they are more confident to speak openly, to convey the needs of our constituents. Because understanding programmatic in CCM is not easy. Mainly CCM does not only discuss one disease. So that all CCM members are expected to understand at least important issues related to the 3 diseases. And now with the COVID-19, the challenges are increasing, and I think we really need to improve the role and functions of the CCM. Yeah, that's my perspective from the CCM member. I hope it's useful, Rachel. Over to you. Thank you.
Thanks so much, May. And it is definitely very useful. There's a lot of things that we can learn from each other in our different capacities. And May has said that this is a very new way of working. We don't know how long this will continue. It's actually made things very difficult for communities and civil society to participate, as there are many different challenges that we have facing different communities, specifically and most importantly, key populations and vulnerable populations. So I'm going to then encourage again and remind everyone to use the chat box for further questions and interactions, acknowledging also that we do have the breadth and depth of speakers, but we also have quite a few technical partners on the call besides our colleagues from the CRG department in the Global Fund Secretariat. So Dave, in the interest of time, over to you.
Thank you so much, Rachel, and really, really good to be here, and so good to see so many familiar names on the chat list and hear some very familiar voices, but also see some unfamiliar names and voices as well. My name's David Traynor. I work at the Global Fund Secretariat, and I'm a Senior Technical Coordinator in the Community Rights and Gender department within the organisation. In the interest of time, I'm going to be very, very brief, I promise. I did want to start off with a couple of overall comments though. One, and I think it's true, and I think we all recognise that we're having to learn as we go rapidly in the context of COVID and how it's impacting on HIV, TB, malaria programs, but communities more broadly. That said, I think there are some things that we know absolutely, and we know all too well, and that key populations, communities that are criminalised, marginalised, stigmatised, alienated, tend to fall to the end of priority lists. They are disproportionately impacted by a whole range of social, economic, and other legal impacts and consequences of COVID, and similarly for vulnerable populations in the context of malaria and tuberculosis, undocumented migrants, internally displaced people. These are all people we know will actually face continuing and exacerbated barriers in access to health services, but also social protection. So I just want to make that point. We do know. The other thing, and it's just to talk specifically to community and civil society engagement in particularly the C19RM application process. So I think, as Gyeonggi really well articulated, that the operational flexibilities proportion of funding was intended to be extraordinarily rapid, and that was why the decision was made to use particularly and focus on PRs and reprogramming. The C19RM mechanism still has to be extraordinarily rapid, but it does require, through CCMs, documented and evidence of engagement of communities and civil society in the development of responses. And as I think Gyeonggi said, these aren't exclusive funding streams. They're mutually reinforced. They're meant to be mutually reinforcing. So there is a requirement for community and civil society engagement. We do understand, and I think everybody, and particularly those of you that are working on the ground, understand that this presents really significant challenges, particularly given the time and the speed that these applications, that consultations are actually occurring. So I just want to own that and recognise that. So I'm just going to talk really briefly about what we're trying to do internally in the Secretariat to support, sorry, back to the first slide, thanks, Rach. In the Secretariat to support the evolution of the portfolio and grants to operate effectively and support our responses for key and vulnerable populations, but also maintain, sustain and scale up community-led and community-based services and engagement in health responses. So you'll see later in the slide, I've provided some links. We've developed a range of additional guidance, which is more, it draws on, of course, our partner organisations, technical guidance, WHO, UNAIDS, Stop TB, and Rollback Malaria and others, to further locate that guidance within the Global Fund grant environment. So I really, really strongly encourage people to have a look at those, because as you're advocating and as you're negotiating inclusion of critical initiatives to support communities through COVID, but also to mitigate the risk, the consequences and the impacts on HIV, TB and malaria pages, they're a critical source to use in your discussions. We were doing and have been with partners again, with UNAIDS, WHO and others. We've been implementing a range of different kind of trainings, I suppose, for people within grant management, but also as part of that, particularly kind of public health monitoring and evaluation specialists. And those trainings are about how do you adapt, for example, key population programming in the context of COVID. So including things like a really critically availability of OST, how do you actually, and what do we need to do to evolve programs to make sure that there's continuation of access to essential services for communities. Within CRG, within the department, we have, I think it's 7 technical advisors who work directly with country teams and grant management. And they've been providing, and there's a couple on the call today, Palani and Hayung, and they provide direct support to country teams to help navigate the complexities of evolving programs and reprogramming and addressing issues that are arising. We're coordinating, we've been providing and supporting technical assistance in response to what are clear human rights violations under the guise of COVID required restrictions. And we are very, very aware that these are happening across multiple contexts. So we've been supporting where we can to respond to those. We're coordinating increasingly with technical assistance partners. So French Expertise International, the German backup program, GOZ, the US government, UNAIDS, WHO. There's now kind of, I think it's bi-weekly or weekly calls and ongoing coordination with those actors to ensure that, and from our perspective, from community rights and gender perspective, of course, it's making sure that what we're hearing from the ground and what we know are priorities in terms of responses, community responses are actually being prioritized within the work of those agencies and within our own. We're spending a lot of time, as you recognize, consolidating and collecting and trying as best we can to understand practically what's happening on the ground and making sure that that's being communicated to executive management within the organisation. And I really want to thank and appreciate and recognise the regional platforms, of which CASO is one, and other community actors for, you know, it doesn't surprise me at all, but it's always extraordinary how quickly communities organise to start collaborating and identifying and communicating upwards to duty bearers what's really happening on the ground. And that's really important for us as an organisation that sits very remote from countries and from communities. And we've been at a kind of a pretty high level with the executive director and senior management, active advocacy on ensuring that there's community and civil society engagement in some of the global COVID response platforms that are emerging. So the one that comes immediately to mind is the ACT-A initiative, which didn't originally include any civil society or community engagement, and we've taken a very kind of clear, resolute stance on the need for those mechanisms to access, respect, recognise the unique and extensive expertise of communities in civil society. That's a bit of what we're doing. There's more. Things are fast moving, but it's to give you a flavour. Next slide, please, Rach. Okay, so as I mentioned, we've been producing at kind of rapid rate updated guidance and information notes, drawing from technical partner guidance. As I think most of you know, the Global Fund's not a technical agency, and all of our technical or technical briefs guidance are actually drawn from those produced by the relevant and appropriate technical partners. So you'll see in all of the disease and also the RSSH, the Resilient Sustainable Systems for Health information note, and you'll see that cross-cutting within them are kind of emphasis around the criticality of community responses, of actually recognising and responding to gender inequities, and different approaches and a focus on those communities, most marginalised, key vulnerable populations within the context of the 3 diseases, and similarly amongst RSSH. I just wanted to draw quite specifically though on the guidance that we've developed and distributed with respect to human rights in COVID. And just to note, so within current Global Fund granting and within our current policy and stipulations, all principal recipients or recipients of funding have to, as part of their contractual agreement with the Global Fund, have to meet the 5 minimum standards with respect to human rights. And I'll just quickly refer to the non-discriminatory access, using only scientifically sound and approved medicines or practices, not employing methods that constitute torture or that are cruel, inhuman or degrading. Importantly, respecting and protecting informed consent, confidentiality and the right to privacy. And I say that importantly because, you know, as COVID responses develop, you know, there is, I think, a very legitimate concern about the utilisation of technology or contact tracing for alternate purpose, and that's a particular concern for, of course, communities that are unnecessarily criminalised and marginalised, and of course avoiding medical detention and voluntary isolation. I've given the links to those guidances, and they also, within those pages, you'll see the technical partner guidance that underpins a lot of that. Next slide, please. Thanks, Rach. So what can be funded under the flexibilities in C19RM? And I'm speaking very specifically from a community rights and gender perspective. It's really important, though, really important that as people are thinking through how to ensure that the things that you know are a priority for communities on the ground, that they are linked with the 3 priority areas, the identified areas for which we've got board approval to fund against. So it's mitigation of the impact of COVID on HIV, TB and malaria programs, reinforcing the national COVID response, and urgent improvements in health and community systems. I emphasised urgent because there's a practical reality associated with this funding, which that it has to be, for the C19RM particular funding, it has to be fully expended by the 30th of June 2021. So there's a year timeline, and we know, unfortunately, that certainly in some aspects of community responses, historical underinvestment leaves systems already weak. So it's really important to think through kind of what can be practically done within that period. So I just wanted to give some examples of what can be included. There will be, and as I think, you know, everybody recognises and understands that the demand is so huge. It is so huge in terms of both COVID, but also how we respond to and try and actually ameliorate or mitigate what are some of the forecast impacts on communities as a result of disruption, slowdown of programs for the 3 diseases. You can, and absolutely it's important, an important area to include programs that respond to gender-based violence. Strengthening, adapting community-led HIV service delivery models for key POCs. And I think Spirit Tia spoke to some of that. Community-led and based monitoring for impacts on the 3 diseases, but also for COVID responses as well. Community mobilisation and advocacy. So you know, a range of activities that are really critical and could be included there. Integration of COVID prevention and support in community-led and community-based HIV, TB and malaria responses. And monitoring of human rights violations, support for access to justice, legal literacy, stigma and discrimination, and as well as health provider and police training on rights and medical ethics. So there are a number of interventions or program areas that could be included. You know, it will be context specific as everything is. So it's also, I think, a really important. It's an unfortunate importance with only a certain amount of funding available, and that's the reality of it. I don't want us to overstate that. Thinking through prioritization. So what is the most critical aspect that's actually going to have the most significant benefit and contribution to communities? I think has to be a discussion there. I'll stop there and kind of open it up to questions.
Thanks, David. As always, your brief was your standard brief, but I think all of us really would appreciate. I really do appreciate that really substantive and really practical guidance that you have just provided for us and.
Jen?
Apologies, we do have quite a lot of technical difficulties today. But so thank you so much, Dave. Again, there was so much information in there, and this is really helpful and important, specifically for communities and civil society during this period of time. We are getting some questions, I think, on the chat box and some information. I'm not sure whether you want to take a little bit of time to respond to some of the comments that have been made as well, or especially Abina's raised something very important around what the situation is happening now within India, and some of the discrimination and challenges that we're seeing and violation of human rights. If you would like to just take time to respond to that, and I'm just checking with people if they have any questions and in addition to what Dave has shared that they'd like to ask at this point of time. I do not see any hands going up yet. Dave?
Yeah, hi Abina. It's really good to kind of see you on the chat room. Yeah, like I mean, from the comments, I mean, they're comments, and there's some really kind of concerning things in here as well. But I think, and I don't know, like it. You know, making sure, following the kind of process that's been outlined in terms of engagement with the CCM and with partners as well, making sure that kind of, you know, as best possible. Partners are really stretched as well. So UNAIDS, WHO, so addressing those issues and making sure that there's kind of multi-stakeholder advocacy and support to address some of those. But I mean, yeah, like I think there's, again, a lot to do. And from the list that Abina's just kind of written up, I mean, just kind of immediately, I think some of them, you know, could be included in the request. Again, everything will actually be kind of have to be balanced against each different priority. That's not really an answer, it's more a statement, I'm afraid.
Thanks so much, Dave. I think Abina is I'm not sure whether Abina is online, but I think Sylvester is online, and she works very closely with Abina. I do see another hand raised. Blessy, would you like to ask your question?
Yeah, it's more a comment than a question. TB services, we have found from early April that they have been extremely challenging in India and in many other countries around. And we did share some of the initial reports. So what has happened post that is we have managed to have a call that WHO headquarters organized with the regional advisors of all the 5 WHO regions. And we came up with guidance, and specifically for Southeast Asia region, we will be having a call next week with the country offices, just highlighting the issue, because what has happened is in India, we did get a copy of the letter that was sent from the NTP, but a letter doesn't actually mean anything if you don't have mechanisms on the ground. So having a piece of paper is not really, I mean, almost on a daily basis, we are getting information about patients not getting treatment, and then there's a big issue with that, and we have to really mobilize support. The other issue is that the deaths, the 120 deaths that happened in Mumbai prison from COVID, most of them were HIV positive and TB patients. And there was an article earlier this week that was published in the paper that quoted some of us activists. But what everyone was asking for was specific guidance for prisons and other, congregate settings like that. So, what we've managed to do is try and reach out to CDC and other organizations and got some information and have made that available, but it requires a lot of change in infrastructure. So, there's while there is a huge risk that people in prisons, especially TB patients, people living with HIV, are more at risk of getting COVID and perhaps even higher death rates among them. How do we support the programs, the HIV program, TB programs, to deal with the specific ministry to support them in doing some something on the ground and make some changes. So I'm wondering if Global Fund has any advice on this, any documents on this. I haven't seen anything even from Stop TB, I think, with regard to prisons. So just to say that people like us on the ground are really struggling and could do with some support in terms of information coming really quickly so that we can address the situation. Thank you.
Thanks, Blessy. This is Rachel. I'm just going to introduce you very briefly. I should have asked you to introduce yourself as well. So Blessy is working with GCTA, the Global Coalition of TB Activists based in India. David, before you respond, I'm also going to point to your attention that there are 2 questions that perhaps you could have kind of respond to. One was earlier from Jeremy, trying to scroll through the chat without crashing my computer. He's a CCM youth rep from Malaysia, and he had a question around youth engagement, but specifically around how we young people involvement during this difficult time and their contribution to the responses across the 3 diseases. Also welcoming other participants of the call to share their experiences. As well as the last question that was from James around engaging community and civil society beyond the CCM, organizing ourselves before the CCM member engages in CCM meetings will be a huge challenge, specifically for many of the populations across the 3 diseases. So over to you.
Sure. Just quickly, so on the, and maybe James, or if there's somebody from WHO or somebody else on the call around COVID in prisons, I believe that guidance was published a couple of days ago. I can check on that. But yeah, no, absolutely. And I think just Blessy and for others, like certainly, I think the big question, like from a Global Fund perspective, like engaging in Global Fund, what in terms of the particular challenges facing TB programs, what would be the priority within a C19 application in terms of mitigating those impacts, understanding that funding is not going to do everything, but how do we make sure that that funding is used most effectively to mitigate the impacts on communities and fully utilise community systems responses and those and the expertise of people impacted by the 3 diseases. Look, on the question of civil society and community engagement, look, I'm not gonna pretend it's not gonna be difficult. I'm not going to pretend that there aren't going to be major challenges. We know that there are challenges that are historical and deep-rooted. So I don't actually have an answer. What the advice is, and given the speed at which this is actually happening, so we're talking about requests that it will be developed in the next couple of weeks, 2 to 3 weeks, 4 weeks maybe. So things will happen quickly. There's a few things. One, your CCM representative is critically important here. So make sure that you are directly in contact with your CCM representative. And similarly for Jeremy, in terms of the particular, it's great it's really, really good to hear that there's a youth representative on the Malaysian CCM, but making sure, and this puts a lot on people's shoulders, but making sure that youth perspectives are actually feeding into those processes. It's not ideal, and I'm not going to pretend it is. I think, so it is kind of using the structures that are there with all their flaws and all their weaknesses. I think more broadly, I think as things continue to evolve, like for example, if there is a significant challenge or there's been an issue in community perspectives, civil society perspectives being actually reflected in any final decisions and outcomes, I think contact with your FPN, but also with the CCM hub, and you can include, of course, the relevant CRG advisor, and we'll do our best to kind of work through those issues. But I don't want to pretend that this is going to be smooth sailing. There will be challenges, but communities are extraordinarily resilient, extraordinarily persistent, extraordinarily active and smart, and yeah, I think we will continue to, from a Global Fund perspective, we'll continue to actively support that. Sorry, one of the things we are trying to do, and it's part of the CRG-SI, of course, is see what we can do in terms of our rapidly deploying technical assistance. Now, we know we can't actually get people into country to support. We know that there is a volume. There's an anticipated 100 funding requests coming in at the end of May for C19RM at this stage. So being able to deploy rapidly specific TA country by country by country, it's just, again, I'm not going to pretend that that's actually doable. It's not. But looking at kind of other mechanisms, part of the reason, of course, that we're working, or Gemma, who I think is on the call, is working with the regional platforms, is to see what we can do as best we can to get information out there. I think the other really, really critical thing here is actually technical partners. So UNAIDS, who I know in this region have been highly, highly active and really supportive, but making sure that at CCM levels where WHO and UNAIDS are represented in most instances, that they're actually there, and if they're seeing that there isn't active community engagement and civil society engagement in those processes that they're raising, this is an issue at the CCM. And letting us know as well, of course. I wish I had clear answers.
Thank you so much, Dave. Yeah, I think you're absolutely right that there will be challenges, but I think throughout this, and I think throughout the presentations today, I think we're witnessing how extraordinary the communities could be and has been, and how critically important it is for community system to be strengthened and for all of us to be engaged in this response, but not losing sight of all the other works that we've been doing building up to this point. So thanks again, David, for taking your time, and thanks again for everyone staying on. I'd like to move to closing, just to wrap up, and again, apologies for going over time on the webinar today, but I hope that everybody has found this really helpful. So RD, may I turn the floor over to you for a few closing remarks? And yeah, thanks.
Yes, thanks, Jen. And just to really express thanks to everyone who stayed throughout the call, to all our speakers. We have FPMs, we have Stop TB Partnership. Hi, James. Thanks for being in the call. It is a community. It is really lovely to hear the voices, and we've had very substantive discussions from the perspective of APCASO and APCRG. And I'm sure GFAN Asia Pacific will agree. This is an ongoing discussion that we're willing to take as our responsibility forward. We would be very open to hearing suggestions from our partners if there's any appetite or need for continuing conversations, perhaps on even more focused themes related to COVID or beyond, as well as the 3 diseases, and we'll keep that in mind. And I guess Jen and Rachel would also be providing information in terms of where, what we will do in terms of immediate follow-ups, like sharing records of the call and the slides and all the information. But again, thank you, keep safe, and looking forward to ongoing conversations.
Thank you, Adi. Thank you, everyone.
Thanks, everyone.
Bye.
Thank you, everyone.
Actually, yeah, thanks.
Thank you.
Thanks, everyone. Just to follow up on RD, is that we will be sharing the slides on our web page as well as on our Facebook pages. So stay tuned for that, as well as the notes from the page. The recording will also be made available, as mentioned by Jennifer earlier on in the call. And we thank everyone for taking time out. Please stay safe. Wash your hands regularly. And we hope to see you, not virtually again, very soon. Take care, everybody. Have a good day.
Thank you.
Thank you. Thank you so much.
Bye.
Bye.